Every day, millions of people foam roll, scrape, stretch, and buy gadgets that promise to release their fascia. But what if much of what we've been told isn't actually supported by science? Today, we are separating facts from fiction, and welcome back to the show, Dr. Jason Amstutz.
Thank you, doctors. Nice to see you both again.
Same here, buddy.
Thank
Hey,
you.
Jason, let's start out by asking it. If someone walked into your clinic after spending 6 months learning about fascia on Instagram, TikTok, whatever, what's the first thing that you would unteach them?
Oof, that's a great question. First thing I would unteach them is that we're only getting generally 50% of the equation of what the actual physiology of fascia is. And that's simply most models and most conversations and most techniques, both hands-on and also corrective exercise, are missing arguably the most important, which is the fluid. Like there is no biotensegrity, there is no living fascia without the volume that is taken up by the interstitial fluid and other fluids of the body, period. So to look at this thing as a collagen-only, protein-only based connective tissue is literally 50% at best. And from a functionality perspective, I might even rate it 30%, the fibers portion.
So what is probably the most misunderstood thing about, this tissue, fascia, that everybody talks about in the human body? Is it something that you can narrow down, because you hear about it all the time?
I think it's in the same vein of conversation. It's directly related to the fluid, the tissue hydraulics. We are a pressurized hydraulic vessel from top to bottom, inside to outside. Every single component, not just the fascia, by the way, but we'll stay with the fascia conversation since this is why I got invited. Everything is based on the fluidity of the fill in the blank, the organ, the covering of the organ, i.e. fascia, all the vessels and how things move, how we are able to assimilate oxygen into our body, take it from the air around us and put it into our blood system. That has to pass through all these different layers of fascia. That is the most important piece, is the health of this tissue. And I think the biggest missing part is, and this is what I go around teaching, both hands-on techniques and otherwise, is how to respect this part of what we're already doing. This isn't something that we're like suddenly going to now treat, but we just need a different lens, I believe, on how we can manipulate this body, whether it's an elbow, a wrist, a concussion. I mean, the highest level, in my opinion, of understanding the fluidic concepts and constructs of the body has to do with concussion. It's not always a bunch of gray area damage. That damage comes from not taking out the trash because you're not sleeping and you have problems with the lymphatic exchange in the brain, which is called the glymph system, and or you're not getting enough arterial blood, or you have a backup in the drain system and you don't have enough draining of the venous system. And if you alter those pressures by just a little bit, plus you add the cerebral spinal fluid pressures in there, we have a very, very sophisticated sense of what is normal and not normal. That's really what drives the concussion conversation. But again, that's the up here understanding of the fluid dynamics of the body. But to bring it to the rest of the public, I think that's the most important part, is that has to be respected.
Is all fascia the same? Because we hear about fascia underneath the skin, the dermis, and then there's fascia around the gut that we are hearing more about. Is there a difference?
Yes. I mean, the sophisticated classification of fascia is not for this conversation, but there is all different classifications. This all comes from embryology. What portion and what part of embryology did this develop, and where did it develop from? Because remember, we only start off as two different cells, and we become an embryo. Then that's all. The majority of that is done in 8 weeks. I mean, it's 9 months gestation or 10 months gestation period, but most of that is a furthering of advancement of the brain and some other things, but all the parts have been there since the 8-week mark. And the point of that is simply to go from 2 to an embryo, and everything started with the same 2 cells and 3 layers. They all get intermixed and intermingled. So that's the embryological understanding, and that's an important piece, I think, for the further understanding of fascia for doctors and things in our space. But I think the important piece of that for this conversation is that, yes, there are some superficial fascia. The superficial fascia can be in different areas. It's not just underneath the skin. That has one construct or feeling to it. But the rest of the fascia of the body, I mean, a ligament is fascia. This is another reason I want to, it's not the classification of fascia. That's the broad overlining or overhead bullet point. But then you have this whole entire list of these specialized tissues that all are fascial. Ligament, the tendon, the periosteum, the dura mater, the covering of the organs, etc., etc. So are they similar? Yes, they're similar, but some of them are thicker and denser and more elastin. And just like a ligament, like the tissue has different pliabilities depending on if it's a deep ligament of the spine. We know that those move, but they don't move quite as much as the ulnar collateral ligament of the elbow as far as flexibility. And that's not because that they're a different structure per se, but because they have a different recipe of the same things. One of the types of collagen, there's 24 different types of collagen in the body. And this gets mixed with water, which comes through the extracellular matrix, and then different amounts of fibrin, different amounts of elastin. And this is what makes the fascia. So
I got to ask you, wait, you just said something remarkable. For as much as we've been working on the body and understanding the science about it, how many different types of collagen are there?
24. There's at least 24 different types of collagen in the body.
Really?
Yeah,
okay.
Biochemically, histologically, yeah.
That is fascinating.
And they all have different functions, and they're found in different parts of the collagen matrix of the fascia and other places. Yeah, it's not all the same.
Very, very cool. I bet most of our listeners and viewers didn't know about that. Especially with collagen being such a hot topic to supplement your diet with nowadays,
Right.
So okay, here's probably a big question for most people wondering. There's so many different ways to work on fascia. What makes your approach so valuable and so unique? I mean, we talked I mentioned earlier, foam rolling is working on fascia. You go to the massage therapist and I'd like deep tissue massage, and then most guys go, all right, that's too much. But
or they get their elbow in and they're digging their elbow in.
Right. So in a nutshell, what makes this different is respecting the fluid. If I'm using my elbow or if I'm using a foam roller, I am not respecting, for the most part, the fluidic nature of that living tissue. And you don't have to take my word for it. And if you ask me for references and things, I mean, you can scour books and all this other stuff, but I recommend that people get to a dissection. You guys need to come sometime with me to one of these dissections. So the body is untainted by chemicals and harsh preservatives, formaldehyde and others. So you only have, the clock is ticking because this tissue will rot in a short amount of time. So we take about anywhere from 5 to 7 days, and you're working 12, 14 hours a day, and you only refrigerate the body. That will change your hands-on and your understanding of fascia in 1 week. Because none of it is hard and beef jerky or any of those things. It literally responds not only to the heat and temperature of our hands, which has been known in the hands-on aspect of, the history of the world treating people. There's something magical that happens with our hands. Part of that is the interaction of my energy with the actual tissue. And that can change the movement and the quality of the fascia via the water mainly. Not because I'm changing the fibrous part. Everybody wants to tear the fibrous part and open the fibrous part. But if you just took a little bit of extra time and kind of manipulated the tissue as a system and you move the fluid better in there, that's what takes the years off the athlete. A prime example of this right now is everything that you're seeing that's crazy with Christian McCaffrey's training and what he's doing now at 31 years old. And everybody, Instagram is like such a hilarious thing. But it's like you got people that always want to comment on other people's whatever they're doing. But the most important piece of that is, this is a guy he's 20 years. His training age is 20 years at least. And if you got a training age of 20 years, you need to start morphing and adapting what you're doing to stay alive and stay in a game like that. You wouldn't do that from the time you're 17. He's already put in the time in the gym and all of the heavy lifting and all of the sprinting and all of those things. Now he's trying to preserve. And now you see him moving more eloquently. And we all need to be doing that at some part of our training, re-education, part of our rehab. I mean, we try to take advantage of every athlete that comes in post-surgically and revamp their entire body with the movement of the fluids better, because that decreases the age of the tissue. It's not the number in the passport.
All right. Somebody needs to do some work on Madonna. I don't know if you've seen she looks like she's going to crumble on stage. I do have one more question. But Terry, I know you were going to ask something. We often talk about how adhesions occur, the muscles that are wrapped in their individual sheaths, and then from repetitive micro trauma or overuse, they start to adhere together. How is that? I mean, is that considered fascia? And the work you do, is that part of what we try to do, is make it move more smoothly?
Yes, but I think, we're back to the same, I'm going to try to keep this theme for the next 50 minutes, and that is, it's not just about the physical collagen sticking together. It's because of the lack of lubrication from the water and the hyaluronic acid in between the layers. So again, lens one is we go when we try to strip these things from each other. Okay, I mean, that's fine. I mean, that's part of the game, but the real game, from my perspective, in this other osteopathic model, is if we just restored the fluidity in the interstitium of those layers, now they glide. So are they really stuck together and fibrosed? I can tell you this from dissection. One of the places that I've studied dissection with like a crazy anatomist is in Canada at Queen's University in Kingston, Ontario. And before we even open the body, after saying a prayer and being very thankful for the ability to be able to be in that environment, right, with somebody who has passed, which is like just in and of itself another thing, we go through and palpate this entire body, chiropractic, whatever your modality is. You go through and you make a long list. Oh, there's a big ankle fixation. This is the story I'll tell. There's a big ankle fixation. The woman at that time, that particular specimen was, I don't know, she was like early 80s. I don't remember her cause of death. But anyway, you go around. She had a big restriction in her upper cervical, but her whatever ankle was like locked and not moving. So I think the normal way of looking and viewing that would be, it must be she's 80 years old. She's got to have a bunch of arthritis in it. There's got to be a bunch of fibrous adhesions, to your point, in this ankle. Well, fast forward, it takes 2 days or a day and a half at least, depending on how good you are, just to take the skin off. That's how important for this conversation the skin is, and what we do to the skin, how important it is to the fascial body. Because it is adhered that much that it is this is 5-6 people on a body, not one. Because you can't just pull it off. It doesn't come off in sheets. You can barely get it off. Finger pads, bottoms of the feet, the places that we are highly sensitive, it's like you can barely separate it from the underlying because it's so embedded with these reticular fibers. Anyway, that's a different story. So we go on, we get to the day, whatever it was, and we finally get to the ankle, and we open up the ankle, and they're literally in the tissue, whether it's the ligament, the tendon, in the area, there wasn't any signs of any like major gross, like scarring, kind of we have this scarring thing in our head and these things are fibrosed and stuck together. There really wasn't a whole lot of evidence of that. And remember, with this kind of prepared body that's only refrigerated, you can still see all the fluid in the tissue for the most part. Now, it's drastically different than the day they died, but it's way different than what 99% of the world is dissected. I can tell you that. Then you go to the joint aspect, and the joint, not a lot of arthritis or arthrosis, because technically a mechanical problem with the joint is not arthritis anyway. It's arthrosis, which means, it's had some wear and tear over its life, right? Non-chemical based. And it's like the whole thing was shut together, the mortise and the subtalar, and that was it. So then we can actually do some of these techniques that we do on a live body to open up the space between the tibia and the calcaneus, and between the calcaneus and the talus. And you can then repalpate just right there on the dead person. I didn't scrape a thing, didn't rub a thing. And then the whole thing is like this pliable hind foot that you would expect to feel on an athlete. And that's because we drew the fluid. That's because we were able to move more of the fluid within that sticky joint complex, which is why this type of conversation about pumping and other things related to the joint is why every chiropractor, in my opinion, should be going through this program, because now you have the mastery of the adjustment, which is important when it's important, but sometimes you have to restore this fluidic nature to the joint, and that's what takes it to the next level, and they don't get another injury in 4 months on the same side. Part of that conversation.
So those listening to us hear fluid. Does that just mean I drink more water? Or how do you get this fluid into these joints, and for this layperson doing, is it a stretching thing? They drink more water? Do they put creatine in the water? They put electrolytes in the water? How do we get fluid into the systems?
How many questions are you going to ask me at once, Doc?
I'm going to throw them all at you because I know you can handle it.
Okay, let's see if I can remember them all. The short answer is yes, of course. You got to have water. You have to have high quality water. Part of this conversation is the quality of the water that these athletes and we are drinking matters. Because in an ideal situation, we have an empty stomach and high quality spring water, not even man-made. You know what I mean? Like that's how it goes, which is you can read about water and there's all these water nerds on Instagram, and the structured water and all that stuff is real. That's why we're supposed to be drinking live water, because the water should constantly be moving. Anyway, empty stomach allows us to bring the water into our body, and then the majority of it we don't need to digest water, right? We remember from just basic physiology, whether it's high school or chiropractic school, that the water moves freely throughout the body, right? From areas of lower concentration of solute to higher concentrations of solute. So if we mix it with food, coffee, electrolytes, anything besides salt, now we have to get those things out of there, which requires the liver in a kind of a cleaning of the water. And that's a different process. That's more intracellular based. We want to be focused for this conversation on the extracellular water. The water that's in the cells, we die without that. That's not important, but you're talking to me about tissue health and hydraulics that I'm talking about. And that means we got to get the water, to your point, into this area. And how do we do that? We got to start with high quality water on an empty stomach. So what does that mean? That's depending on where you're at on the water, like how much water you drink. That's first thing in the morning. I drink a liter with some high quality salt. That's it. No electrolytes. Those are all chemicals. That requires a whole nother scrubbing and your liver use as well. Most people's livers are backed up, for many reasons. And then an hour before my next meal, when my stomach is completely empty, and so on and so forth. So that's the water. That's how we can manipulate the water to be best available for this interstitial fluid in space. Make sense?
Mm-hmm.
Oh, yeah.
It's not rocket science, right? This is just physiology. Yeah. So then the next question is, how do we get it into these places, Doc? Well, depending on your age, we won't even go age. We'll just say we have an 18-year-old male or female athlete. They eat high quality food. Don't forget the quality of our collagen and all these other things depends on the quality of our food. That's another podcast with other people, but that's important, right? And then if you take that piece of it, and they have no injuries and no previous problems, you move the water by doing all of these incredible movements that you see with all these different movement experts. And I'm not here to pump any of them, but Gymnastica that, Dr. Tim Brown likes so much. This Ido Portal is gaining a lot of notoriety and more traction. He's been around forever. You have to move these joints through all of these different positions. That's the deepest conversation, as well as the more superficial pieces. So could that be a proper myofascial stretch? Yes, but we use the stretch specifically for an issue we may have found with our hands, or based on their previous injury of 3 times they've tore their left hamstring. We might be more specific with what we do versus a more global approach of moving the tissue, because if we change the pressure in the joint or in the tissue itself, that's what moves the water. So you cannot neglect any movements in any direction. Again, this is a well patient, well athlete. And that's how you maintain as much of this fluidity of the deepest joint, the facet capsule, the blah, 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 the water and fluid, synovial fluid that's in the facet. That matters too. And that all comes through movements, which is why movement is medicine. That's been around since Hippocrates. Movement is medicine.
I'm fascinated at the thought that back in high school in the 70s and 80s, you weren't allowed to take a break to drink water during your wrestling practice or football outside or whatever it was. And the thought of that today is just corrupt. It's especially after what you're saying.
Right. Well, and you just saw in the World Cup, this is the first time I remember in the World Cup there being a water break.
Yeah, it is the first time they've did hydration break. Uh-huh.
Is it? Yeah, first time.
But
those guys know. They know.
Well, they also talked about that the reason they're doing it is you have football, you have all these other sports, they take timeouts and everybody runs out and gives them water. In soccer, there's no timeouts. So they're running for 45 minutes, sometimes 50 minutes without ever putting fluid in. So people were like, oh, these guys are a bunch of wusses. They need a hydration break. I'm like, and I flip back, go, look at every sport out there, basketball, football, and they all have timeouts. And that's when the athlete trainers run out with water. So they don't have that. So they had to have that. Let me talk about communication. The cells are all communicating. And what do you think about like the fascial bounce or stuff like that? What's some things that to get this hydration flowing and to increase this cellular communication besides just drinking water and having a therapist run their hands through?
Well, I mean, I don't know what the fascial bounce is. I can imagine what it could be. But I mean, that a lot of these things, see, the lymph system is part of this continuation of the water in your body. The water gets into the interstitial tissue. And there's going to be a question at the end of this. I'm going to quiz you both. So you have water in the interstitium of all the tissue of the body, right? All the connective tissue, fascia for this conversation. And then you have the lymph system. And then the lymph system empties back into the venous system, right? That is the flow of much like the movement of water of the earth. That's how the water moves in our body. It goes in here, it gets into my tissue, it goes into the lymph system. It becomes that water, same water moves into the lymph. That's why you don't want any stagnation anywhere in this process, because that's the start of disease. Anyway, that's another podcast.
We have a lot of podcasts.
So that's an important piece. Then it goes back into the circulatory system. So the question is, because there's, fascia is a big word, and lymph, we've been hearing about lymph forever. What is the relationship in volume of water between the interstitium of the body, extracellular matrix for the scientists, and the lymph system? All the water outside of the outside of the pulmonary or the cardiovascular system, or how much is in the interstitium, or how much is in the lymph? Is it 50-50? Is it 80-20?
I have no idea.
90-10? This is important for this, and then I'll answer your question, Doc.
I have no idea.
Just take a guess.
I'm going to go 80-20.
Which one?
Ooh.
Go Good try. 80,
Thank
20.
you.
That's good. That's
Hey, you told me to take a guess.
Throw out two numbers that add to 100.
Right. Well, you're throwing 50-50.
No, 80-20. Hey, you're really close, but which one's the 80? That's the most important part of this conversation.
Fluid.
Yeah, the fluid in the interstitium. 85% of the volume is in the tissue. Only 15% of that water is now in the lymph, in the total network of the lymph system. So now you ask me a question. Is this like bounding, this fascial bounce? Is that like bounding on a trampoline?
No, you know how like Eric Goodman and Foundational Train, how they just do that loose bounce and they just go on their toe. That's why I call fascial bounce.
Okay, great. No, same thing. And that moves the water, but it mainly moves the water in the lymph system. Okay. Although they're interconnected. That's why it needs to be, you have to change the angle of joints and the torsion of the tissues to really pressurize and depressurize. That's how we move the water most efficiently.
Oh, okay.
Because it's all that water is bound together. Like if I cut open a body, even of somebody who's alive, the water doesn't pour out of the interstitium. Why?
Oh, okay.
Why is it only blood on the floor? Why is there no water? Hey, doc, you just told us we're full of so much water, but there's no evidence of that. I saw somebody get their arm chopped off, but I didn't see any.
That's a good point.
That is great.
That's because that water is all bound within the tissue and doesn't pour out of there. And that's through chemical bonds. That's the importance of hyaluronic acid and other type of that. That's what binds the water in the tissue. That's why it doesn't pour out of there. So it has to be a little bit more sophisticated to move it in the tissue besides just bouncing. But if, being in water submersion helps move because you have a difference in pressure between your feet and your head. That's the real way to flush and to recover. This is what these athletes, if you look at all these outliers in all these different sports, and these outliers are mainly the best. Have you seen anything on Instagram where you catch these guys at like away games and there's people taking a video of them down in the pool? That's because that's how you recover your tissue.
No kidding.
By floating or just being in water?
Moving in water. I mean, there's many, but just moving in water because now we have this pressurized. Now we're changing the pressure in the fluid in our body, right? Because my toes are at 6 feet and my eyeballs are at 1 inch. That's a column of water. And that's this is important. This is the graduated micro graduation, right? The higher I come in the water up my leg, the less pressure. That's how you can move the fluid out of a limb real fast.
Oh, wow. Not
by squeezing the leg with these different cuffs and all these different things. There's no graduation. There's no graduated scale in that. It's on off. That's okay for the blood system. That doesn't do a whole lot for the interstitium because all the water's bound together.
So if you don't have a pool, what's a good way to do it?
Well, then you're certain hands-on. This pumping is to change the pressure at the joint to bring more fluid into the joint, especially if it's been lost because they've had a compressed ankle joint since they were 14 when they fill in the blank or whatever, the old dry joint that you and I and Dr. Barron feel and every other chiropractor, the restriction that we feel of mobility in the joint, sometimes it's because, right, if the thing's too compressed, we're going to use the weight-bearing joints. Those are the easiest ones because they're constantly under load every single day, right? Talus, all of that. But the adjustment respects the fibrous portion. My apologies. The manipulation respects the fibrous portion in the immediacy, and that's like the neurologic and all the other cascades, and all of that neurologics mainly comes from the fascia, by the way. We need to get back to the neurology and why that needs to be discussed, because that's all in the fascia. All the receptors for proprioception and awareness of the body are in the fascial system, including the muscle spindle. Anyway. Muscle spindle's not in the muscle. So, sorry, I got sidetracked. My daughter set a timer on my thing.
I do have a question, though, unless Terry, about this. They often, I've always heard that, dehydration even can create a small but very critical shrinkage of the of the dura around the brain, and that could easily cause, awkwardness and inability to balance and have, a peak level of proprioception. But now you're talking about what dehydration can do to all the rest of the nervous system in the body.
And we're only talking about the afferent, or the afferent. Remember, the afferent is 80% of the information in the body is going to the brain. Only 20% is making us act. And all that is embedded in these specialized fascial structures, which often gets missed, I think. And it's just, you just missed a page in the physiology book. Okay, we have all these receptors, the Pacinian and all, the Meissner corpuscles, those are pressure sensors, and all of these different change of length, right? Muscle spindle, Golgi tendon apparatus. But the page in between that is often missing is that where are those receptors located? Some of them are self-evident. Golgi tendon organ, that's in the tendon. The tendon is fascia. Check. Muscle spindle. Uh-oh, doc, you just ran into a big one. It's like, no, I didn't. The muscle spindle complex, which they don't truly understand exactly how it is. There's people that have some drawings and things, but it's in the fascia that wraps around the muscle fiber. It's not in the muscle. The muscle is yes or no, and that question comes up all the time. Oh, why aren't we more sophisticated with our training of the muscle? It's like, because the muscle's just on off. How many motor points in the longest muscle in the body? Longest muscle in the body is the hamstrings. How many motor points in the average human from distal to proximal end?
2.
Yeah, 2.8. That's it. That's how smart the muscle is.
Did you just guess that?
Oh, fuck, I know. It's all in here, baby.
It's all in here, baby.
I would have never guessed that.
Yeah, that's why you just sit back in Florida. Hey, I do have a question before you lean in, because you just talked about this. We're so focused on muscle and MRIs and CTs and all that. We're missing the big boat, aren't we?
100%, 1,000%. The big boat is right next door. It's what makes the muscle function from the periosteum, which is the skin of the bone, tendon. Then you have the aponeurosis and the wrapping of the fibers. Great. But remember, they all come back together as the other tendon. It's all continuous to the other periosteum. That is the functional unit of the muscle, which means we have to respect each and every part of that if we want to build a well-oiled machine athlete that's resistant to. You can't have a weak periosteum, or that'll create a problem. You can't have a weak tendon. There's a lot of research now on tendon training. I think we're headed in the right direction, but now we need to take that same construct and go, how would we train the muscle different from the tendon? We got a pretty good idea. And then what do we do about the periosteal connection? How do we make that more robust? Because I had an avulsion tear one time of my upper hamstring. You don't just keep doing leg curls for that.
We have a machine called an InBody, and I've been focusing so much on the visceral fat and the body fat, but I've also been starting to get really interested in the ratio of the ECW and the TCW, which is interstitial wire and versus the total body wire. And the ratio should be between 3.36 and 0.38. And it's amazing that you're seeing these athletes that are really fit, but their ratio is so far off, and they keep getting strains. Now it's starting to make a lot of sense.
Yes, and this goes right into the model of recovery and healing. Like, we're not, as much as we're trying to facilitate the healing, it really comes through the fluid being better adapted into those areas where they are stubborn. Those are the things you can still palpate after they tear their myotendinous junction of their hamstring or their fill in the blank. You know how we still have those palpable places where you're like, man, this just doesn't feel quite right. The athlete hurts there, right? Like that's the hydration principle of that tissue is what will change it on ultrasound. I mean, that's been proven. I had that experience early in my relationship with the 49ers, and they had a hamstring that wasn't healing on their timeline. I mean, these, talk about numbers, right? They know exactly to the day when these guys should be back. give or take, right? Because they've done it so many times. And they called me in on a special consult. I flew up there and went through my process of treating this fascia as a delicate, intricate, fluid-filled structure, nothing else, no tools, no nothing. Pump the joint above and below to make sure I pull on the whole entire chain, only to move the fluid. Not because it's like 5 weeks, 6 weeks, all the scarring's pretty much done, right? The only thing the tissue has to do now is adapt to stress and load, which they have all that handled. They know how to stress they know how to stress the tissue in the gym, no problem. Multi-angle and all of that. So I leave. And I get a note the next day that, hey, we wanted to show you something because, I had been probably consulting with them for 2 years and talking about the fluid. This is since like 2018 or 19. But it's hard because you can't see it and can't feel it, right? It's like my information that I got from this crazy French osteopath, all this stuff. And then you can see it in dissection at times. Anyway, they did an ultrasound right before I walked in, and they had an area that was showing up in the hamstring that was it was like a dark spot on there that they had been working on for 2 weeks. And they said right after I left, they did another ultrasound and it was gone because the tissue had been rehydrated.
Okay, hold on. Here's an elementary question, but I think it's a big one. We talk about fluids and moving them through the fascia and the body and the lymphatic system and all that, but how do you know if you're hydrated well enough? How can the average person listening to this or watching identify whether they're hydrated properly or not?
That's a great question. And I'm constantly learning about this because I don't use all these metrics that these professional teams do. The highest level metrics that I have seen so far in professional sports, any idea what sport it is? I mean, we're talking about down to the, I think you may have drank too much water kind of people. You know what sport that is?
Baseball.
I'm going to go ultra marathoners or ultra
No,
runners.
professional soccer where the biggest money is. They know they weigh these. One way is to weigh yourself before and after. I mean, that's a really simple area of understanding. A gallon of water weighs 8 pounds. You weigh yourself before a competition. You weigh yourself after. That gives you a general idea of how much water you lost. Okay. So not everybody in the audience is going to do that. The color of your pee is still hard to beat.
That's the easiest.
You know what? That's still really, I mean, as long as you're within some kind of a window and you're not abusing too much water, which leads to its own problems, and you're obviously not dark yellow and all those other things, that's at least a good idea of understanding your hydration. The other one that we like to do, which is a little bit more poignant sometimes with the athlete, is when the athlete's face down and you take the layer of skin on their lower back and I pull it away from the underlying superficial fascia. If it's stuck together and I can't get it to separate itself on some level, then and it hurts them, and they know that when I know and understand that that's a sheer sign that they are pretty dry.
Wow.
Now, there's other reasons for that not being super pliable, but that's kind of an easy, dirty one as well.
That's good.
The idea of identifying how much hydration. I mean, there's also overhydration. But my comment is to the lay people out there that the opportunity to do body composition analysis and all that is so contingent on several factors. Whether you went to the bathroom beforehand, you want to measure at the same time. No diuretics. Did you have a big lean piece of beef before you got measured? Because those all change things. But do you have a suggestion as to when the best time to identify your level of hydration or your body composition analysis? Lean body mass, things like that.
I don't really, honestly. That's not like a measurable that I use on the regular. So yeah. I'm sure there's other ways besides the ones that, have been presented to me or the ones that I've experienced in other places, in other locker rooms, like right next to the urinal, there's little colored things. Seriously, in some of these facilities, like, hey, this means you need to drink another 2 liters. If your pee's this color, you need to do that. So no, I don't really have any more sophisticated data. It sounds like what Dr. Terry was talking about could be interesting, especially if you can see the interstitial water on that type of an image.
I mean, it's pretty cool. But I also I'm going to parlay off of what Spencer said. We see these people carry around their jugs of water, you know, everywhere. And we've had guests on our show going, oh, that's just ridiculous. Just drink on an empty stomach. What's your thoughts on when you see all these people walk around? I mean, they come into my office and they put their big jug on the thing. What's your thoughts? What's your thoughts on that?
I mean, I just want to know what's in the water, where they get their water from, what kind of container it's in. You know what I mean? And then are they adding chemical-based electrolytes to it? Because now you're just taking in some other synthetic that needs to be processed by the liver.
Yeah.
I mean, the volume, everybody wants to argue about the volume and how much, they want to ask me how much water. It's like, wherever you're at, your kidney has to respond to this. You can't just start drinking 3 liters of water tomorrow if you're at like a 1 liter person, or everybody says the same thing. Oh, I can't do this anymore, doc. I spent the last 7 days in the bathroom 10 times. It's like your body has to adapt, and you can't overshoot the 1 liter by 2 more liters. The body has a really hard time adapting.
Your idea of, or our idea of color, getting the chart, the P color chart. You know, what was funny is that I often tell people to go ahead and, you know, grab one of them online, you know, just print it out, post it on your bathroom wall. And then they'll ask me, they go, is it the color coming out or the color when it hits the toilet water? And I go, well, I think it's the color coming out, I would imagine.
Yeah, totally. That's awesome.
They often, now this is crazy, but I just heard this on Instagram, and that was the concern of using a stainless steel decanter for water if you're putting electrolytes in there or whatever, you know, or even you know, flavoring it with lime or lemon, because it leaches out the some of the toxic metals that are part of the stainless steel. Whereas the point being is that glass would be best. Obviously, plastics, we have a big problem with that now that people are much more aware of. But have you heard about that? I
mean, the quality of metal. I mean, that conversation has been going on for a long time because of the quality of metal that's changing in the cars that are made. But you can use any kind of quality of stainless steel, and you either will have an issue. We all know that if you use stainless steel on certain parts of your car or a bolt, that never goes bad, right?
Yeah.
So if you got to have a high quality stainless, I think you're good. But I think what happened is that market got saturated by everybody wanting to get in the game. And then now you have like really, that's an alloy. What you just described as an alloy, which is a mix. Like, who knows what they mixed it with? Yeah. That's a good question.
Interesting. Go ahead, Terry. Were you going to say something else? Or
No.
Okay. So let me ask you, there are thousands of these recovery tools. If someone only had 15 minutes a day where you would have them invest their time, what tool would you, what do you like most? What do you suggest to
This is for tissue.
Athlete?
This is for tissue health, connective tissue health, like this conversation specifically.
Yeah. Yeah. I mean, we talked about, everybody's foam rolling, but what would you suggest?
I mean, foam rolling, that's been disproven, like, as far as like whether it has a positive fascial hydraulic fluid effect 15 years ago. No, I'm not here to argue that. I'm just saying like that's like there's a whole other thing that's going on with using a foam roller, which, if you've talked to somebody that foam rolls on a regular basis and I say that, they're like, you must be insane. What are you talking about, doc? You know nothing. This thing makes me feel so good and this and that. I'm like, okay, take it away for 5 days. I can't take it away for 5 days. I got to do it every day. I'm like, so is it really changing anything? Anyway, the question was, okay, so what can people use? I mean, for recovery, I think people need to go to the basics. I think if you want a true modality that moves water and has a change on the water of our body, it's PEMF. Ooh, but who's going to, I don't know who's going to buy and everybody's not going to go out and buy a $60,000 proper PEMF machine. So if we're not talking about like that kind of level of treating in this realm that we're talking about, I mean, that's why swimming in a pool on your days off and not pounding this body into the ground is so important for recovery. The real basics. Hydration, sleep, grounding, like those are things that everybody wants to skip over and start doing methylene blue instead. It's like, what's your gut status? Do you truly have I don't really know. It's like, why do you not know? Everybody wants to go look at the hormones all the time. And it's like, everything is established from the quality of the gut, including the quality of our healing and our tissue. So why not go there first? Not last on the list.
I'm so glad you brought that up.
Go back to the PMF for the lay people. Uh-huh. Yeah. Were you going to ask that, Terry, or no?
No, I was going to, let's let that go for a second.
Hang on. I want him to mention that. Yeah. PMF. What is it and why for the lay people?
Sure. Pulsed electromagnetic frequency. All of this water has a charge, right? Everybody knows water has a charge. And then very specifically, if you get into other studies of water itself, we have structured water, etc. That's highly charged water. That's what we're a living body. And what does it get charged by? It gets charged by our mitochondria. Mitochondria doesn't just create ATP for the cellular use for energy. These are also little capacitors or batteries in our body. And there's way more of those than there are cells. So if we want to take that model of understanding, then we use pulsed electromagnetic frequency, and that helps change the dynamics of the charge of the body, which also helps with the fluid movement in the body. And we use it very really specifically. Cool. I hurt my knee. People use PMF, right? Like again, not everybody, but I think that's the one that most physiologically and histologically sound that we know of on the regular. There's a couple of others that I don't understand the technology as well that some of my other mentors use, but I don't understand the technology enough to mention it.
That's a great explanation I never heard of before. Terry, go ahead. What were you going to say?
Yeah, I love using my PMF machine. We use it all the time, but I didn't look at from that angle. So thank you for that. You know, and another thing you mentioned is going back to the basics, and then you mentioned methylene blue. I get so tired of seeing all these doctors and these celebrities charting. Oh my gosh, I had this drop it, or I did this, or I ran these IV fluids, and I'm zapping it with this before it goes in the system, and people are forgetting the basics.
Exactly.
And we get so on this fringe, and people are paying thousands of dollars for this fringe work, but they're not really going back to the basics of moving, going on the beach, what Spencer does every morning, just walking the beach barefoot and moving and stuff like that. So thank you for that.
Yeah, you got it. I mean, I think that's the most overlooked part of every athlete's puzzle. Like, what are you eating? Yeah. You know, what are you eating? What kind of water are you drinking? How well are you sleeping, etc.?
Don't you think that's what social media preys on, prize on, is all these little things, and people are always searching for that quick pill, that quick thing, and nobody really wants to put in the work to just go back to basics.
You said it, Doc. That's exactly right. Like, it's sunlight doesn't make anybody any money. Grounding yourself doesn't make anybody any money. Taking your shoes off and walking around in you know what I mean? Like, these aren't big money makers, but this is how you have a foundational hormone system that functions right, because melatonin is the master hormone.
Yeah. Yeah.
I mean, so if you don't have that right, like, then we have a whole other cascade of problems. Why do we have so much low testosterone? That's definitely one of the reasons. Nobody sleeps.
Well, that's one thing I love about my partner. You'll see him on like Facebook, and he posts all these pictures of the sunrise and on the beach. But what people aren't realizing, he's on the beach, probably barefoot, and he's starting his day in just such a healthy component. But they're looking at the picture going, "Oh, that's a nice picture," but they're missing the big reason that of why he's even out there. And so, I think people need to go back and save their money for the skills of the hands, but really focus on getting their basics back. What are some morning for people like Spencer and myself? I go out barefoot out on the grass, and I do my fascial balance in the morning and all that. What's some other basics that people can do just to get off their ass, away from the computer, to start their day?
I mean, just going for a walk. I mean, there's so much research and data that, I think last time I was on your podcast, if I'm not mistaken, I may have been dissing walking at the time because I didn't think it was enough of an exercise. But honestly, the more research and the things that I've read is like, hey, that is a fundamental basic. It's a highly integrated movement pattern. Like you talk about left brain, right brain integration, walking and swinging your arms and legs in opposition, and all of these things that are part of developmental stuff. Like if we lose that, we have all kinds of issues that can happen with the body, neuromuscularly and otherwise. So I think walking, no sunglasses. We wear sunglasses too much, and I don't think people would necessarily do it in the morning. But our eyes are the main photoreceptor of for the melanin in our skin. It's not the skin. If we blind ourselves from the sunlight going into our eyes, we will all get a sunburn because your body has no idea how to throttle the melanin.
Interesting.
That was done. That was some, again, nobody likes to hear about experience. They want to hear about evidence-based research, which we'll keep waiting on all of it for this fascial conversation. But it was a dermatologist in San Diego that noticed that he had a bunch of people that drive because of this, sales people. They all sit on the same side of the car. They all have the same challenges. And he noticed that he had these two different groups of people. One that spent 6 hours a day driving in the same sunlight, with or without tint, didn't really matter in this. And then there was a big difference. There was ones that got cancer and there was ones that didn't. You know what the number one variable was?
Mm-mm.
Whether they wore sunglasses or not.
No kidding.
No kidding. So I'm blue-eyed. I've been wearing sunglasses my whole entire life. I came across this, 10 years ago. I don't really wear them anymore at all. And the skin and my ability to react to the sun in Southern California is that I don't get sunburned anymore.
No kidding. I love sunglasses.
You know what? They're nice. They're nice at times, but honestly, so that's part of the answer to why to get out early in the morning. It's because not only does that set the tone for the melatonin and our circadian rhythm, step one, but it also sets the tone of getting light in our eyes, which, if you look at all the ancient historical texts of what people used to do, they did sun gazing for a reason. That's how you stimulate your pineal gland.
Wow. Very cool. Let me ask you about a basic issue that most people come to us with, and that is, hey, doc, my hamstrings are tight or my low back is tight. Briefly explain what's actually happening that's tight and what can, again, people are foam rolling, but or trying to stretch. Is there a suggestion, or can you first share what tight actually means to that person?
I mean, I don't like to question the athlete or the patient that their sensation is not real, right? So if they feel like their hamstring is tight, I'm going to take it at face value that it could be feeling tight to them. But the number one thing that I think gets skipped over in all of this evaluation process and even training an athlete or a non-athlete is, in the terms of my last 14 years of studying osteopathy, we call it the gravity line, but we would call it your static posture. If that is disturbed by more than a little bit, meaning we have too much weight on the forward part of our foot instead of where the weight's supposed to be at, we have compensations for that, anterior pelvic tilt, all the rest of it. So if that is a piece of the puzzle, that needs to be addressed and changed, or their hamstrings will be tight forever. And with that anterior pelvic tilt, which is a bad gravity line, that's when the whole gravity line, instead of being north and south lined up from my pelvis to my head, everything, the trunk sometimes in these athletes and people is like forward of the pelvis, right? And when you take the weight forward of the pelvis, you mandatorily, for the most part, have to rotate. The pelvis kind of falls more forward, right? We get a hyperlordosis in some people, etc. So I think if that's not being managed properly, which is a very simple way to fix that, is not to stretch the hamstring, but to shorten them, because that will upright the pelvis even more. So that's the hamstring conversation. A tight back, that could be related to the same dysfunctional pattern of gravity line, but I also think that we don't have a lot of strategies in the professional sports world or with our patients that create more space besides just sleeping at night. And the Eldoa, which is, my mentor, Guy Voyer, and the osteopath from France that I started studying with in 2011, he is now most well known on Instagram and other places with his Eldoa concept, which is a specific exercise for each and every disc, and also the shoulder joints and also the hip joints, to create space at night. And that could be another reason, because most people get shorter and more compressed as we age because of gravity and running and jumping and all those things. And we don't take the time. Most locker rooms and PT places or, athletic training rooms of professional teams, nobody's trying to create more length in their spine very often. You know what I mean? And that's a one-way street. And if you keep compressing it, I'm sure it feels tight in a 60-year-old patient. If you don't fight for it every day.
Mm-hmm. Yeah.
So that would be my guess on hamstring and low back tightness.
That works. Well, we are going to start our rapid fire questions.
All right, here we go.
So good luck to you in brief answers.
Brief answers. Okay, I'm
sure you have the
to short
I'm sure you have the answers to every one of them.
Oh,
it's
boy,
just a matter of the big challenge is brief. Brevity.
I like it. Don't you like how he sets you up? Good luck.
Yeah, totally.
All right. Question number 1. What is the biggest fascia myth?
The biggest fascia myth is that it's a bunch of fibrous things that put us together, and that it's an afterthought. It's not an afterthought. It was part of the embryological process. That's how it got there. We didn't go back in and spray paint fascia. Like, that's a very, very misunderstood part of it. It's not just this light stuff in between the layers. It's the ligaments, the tendons, the periosteum, the disc, the intervertebral disc, the cartilage of the knee, the meniscus of the knee. That's all fascia. Specialized.
I like that. Because you kind of touched off on that earlier. Question number 2. Most underrated daily habit.
Most underrated daily habits. I mean, starting your day off with good, clean, high-quality water on an empty stomach.
Ooh. All right. There you go. I thought you were going to say sleep. Well, because that could be
you can't go without
habit.
that either. Yeah.
Question number 3. One thing everyone should do every morning.
Wake up with a positive attitude and remind yourself and be gracious for what you have and the places that your life. I think that's what I try to empower and instill in my kids.
That's cool. We just went from a show that delves into the physical aspect of our programming to the mental, emotional part.
Because it's all connected. Your fascial health will respond to your negative thoughts, your negative food choices, your negative everything. Yeah. Stress is the number 1 killer of the fascia.
Oh,
that's a problem in this country.
That's great. Question number 4. One discovery you're waiting for science to prove.
Waiting for science to prove. I'd like to see a better video or something, and this is probably needs to be done. I don't know if it's going to be done by me, but just to give people this idea of how the water moves in the body. Like, I think there's too many separate parts that you have to know and understand, and very quickly there's a drop off of understanding, and then it's like, what's he even talking about? And I think that literally needs to be proven, because it will up everybody's game in how we treat this human body.
Well, now with all the AI tools, I'm sure that someone's going to come up with it, if it's not you, a good video, right?
Right, totally.
All right, last question, Doc. What's something you've learned about being human that has nothing to do with anatomy?
That has nothing to do with anatomy. I mean, I think my biggest life lesson to date is probably truly understanding the perspective and emotions of another human. I've read a bunch of books on like empathy, and like that's a real thing that used to be part of curriculum for kids, is to teach them empathy. And I think there's too many people in this day and age where we're also worried about ourselves, et cetera, that we don't take the time for those around us, let alone anybody else, to really truly understand where others may be at.
Yeah, especially in the world of healthcare. You know,
Right. Right.
think of any oncologist who tells you your diagnosis. They're so aloof about it, you know?
Right. Right.
Yeah. So I agree, and thank you so much. That was probably the best way to end the show. Thank you
awesome.
for being on.
Thank you
again.
guys. Thank
All right,
you.
my man.
And just share some empathy. You know, we're so glad that we've met you and you're part of our little family here. And it's so fun to have brilliant minds that just can sit and have these conversations. So thank you for your time.
Oh, I appreciate it. Thank you very much. I'll see you guys soon.